Hey, it's been a while guys. I brought a new content today regarding golfer's elbow, also known as medial epicondylitis, and how to treat that. Alright, let's go along. Golfer's elbow is a condition in which the tendon of the forearm muscles attached to the bony protrusion on the inside of the elbow, causing pain. The pain may spread to the forearm and wrist. It's not only limited to golfers, tennis players, and others who repeatedly use their wrist or crunch their fingers also can develop golfer's elbow as well. Golfer's elbow is characterized by pain and tenderness. Pain is usually felt on the inside of the elbow, sometimes extending into the inner forearm area. Stiffness may feel stiff and may hurt when you make a fist. Weakness. Hands and wrists may become weak. Numbness or tingling might radiate into one or more fingers, usually the ring finger and little finger affected. Golfer's elbow, also known as medial epicondylitis, is caused by damage to the muscle and tendon. They control your wrist and finger. The damage is typically related to excess or repeated stress, especially forceful wrist and finger motion. Improper lifting, throwing, or hitting, as well as too little warm-up or poor conditioning, also can contribute to golfer's elbow. Besides golf, many activities and occupations can lead to golfer's elbow. Like sports, improper use of tennis strokes, especially backhand strokes, can lead to tendon injuries. Excessive use of topspin or using rackets that are too small or too heavy can also lead to injuries. Throwing sports, improper pitching technique in baseball or softball, football, archery, and javelin throwing also can cause golfer's elbow. Weight training. Lifting weights using improper technique, such as bending your wrist during your biceps exercise, can overload the elbow muscles and tendons. Forceful repetitive occupational movements. These occur in fields such as carpentry, plumbing, and construction. Risk factors. You could be at higher risk of developing golfer's elbow if you're age 40 or older, obese, a smoker, performing repetitive activity at least 2 hours a day. Prevention. You can take steps to prevent golfer's elbow. Strengthen your forearm muscles. Use light weight or squeeze tennis ball. Even simple exercise can help your muscle absorb the energy of sudden physical stress. Stretch before your activity. Walk or jog for a minute to warm up your muscles. Then do gentle stretch before you begin your game. Fix your phone. Whatever your sport, ask an instructor to check your form to avoid overload on muscles. Use the right equipment. If you play tennis, make sure your racket fits you. A racket with a small grip or a heavy head may increase the risk of elbow problem. If you're using older golfing irons, consider upgrading to lighter graphite clubs. Lift properly. When lifting anything, including free weights, keep your wrist stiff and stable to reduce the force on your elbow. Rest properly. At the first sign of the elbow pain, take a break. Just break. Try not to overuse your elbow. Diagnosis. Golfer's elbow is used for diagnosis based on your medical history and a physical exam. To evaluate pain and stiffness, the doctor might apply pressure to the affected side or ask you to move your elbow and wrist and finger the various way. An X-ray can help the doctor rule out other causes of the elbow pain, such as a fracture or arthritis. Rarely, more comprehensive imaging studies, such as MRI, are performed. Treatment. Treatment begins with avoiding activity that causes pain. To help relieve pain, use ice. Medication. Taking over-the-counter pain reliever, acetaminophen, Tylenol others, ibuprofen, Advil, Motrin others, naproxen, sodium, Aleve. Injection. Corticosteroid injections are not commonly given because they have not been proven to be effective in the long term. Platelet-rich plasma. This procedure involved withdrawing a small amount of blood and injecting concentrated platelet and other anti-inflammatory components into the affected area. However, more studies are needed to evaluate the effectiveness of this treatment. Last, stop playing golf or doing other repetitive activities for a while until the pain goes away. Resuming activity too early can make the condition worse. Putting ice pack. Place an ice pack on your affected side of elbow for 15 to 20 minutes at a time, 3 to 4 times a day for a couple of weeks. To protect your skin, wrap the ice pack in a thin towel. Massaging the inside of your elbow with ice for 5 minutes, 2 to 3 times a day can help. Using brace. It's recommended that you wear a resistance band on your affected arm to reduce the strain on the tendons and muscles. Stretch and strengthen the affected area. Gradually loading the tendon with a specific strength exercise has been shown to be particularly effective. Return to your usual activity gradually. Once the pain has subsided, practice the arm movements of your usual sports or activity. Leave your golf or tennis swing with an instructor to ensure that your technique is correct and adjust as needed. Surgery. Surgery is rarely necessary. However, if symptoms do not improve within 6 to 12 months, surgery may be necessary. A newer treatment called 10X involves removing scar tissue from the painful area of the tendon under minimally invasive ultrasound guidance. In most cases, rest, ice, and pain medication will help. Depending on the severity of the condition, pain may persist for months or years, even if you follow the arm exercise instructions without overdoing it. Occasionally, the pain may recur or become chronic. A brief explanation of golfer's elbow or medial epicondylitis is here. I'm gonna teach you the first major therapeutic home physical therapy. Alright, let's go along.
Don't say, darling, 'cause you'll fake it. Don't hide the tears, 'cause I know you're breaking. All this love and all this pain you've given. All this love and all this pain, you bring them from another world.
Another tear just burst from the side of your eye. And I know what you're saying, and I know it's a fucking lie. All this words, damn lie. All this pain in those fine eyes.
All this love and all this pain you've given. All this love and all this pain, you bring them from another world. Now the summer lies on my doorstep, and outside there's a light and it's getting bigger, and you know it. All this love, damn lie. All this pain and those fine eyes. All this love and all this pain you've given. All this love and all this pain, you bring them from another world. All this love and all this pain you've given. Easy come and easy go. You're an unfading star, a gentle love, the kind that lifts you up It's like we've always known, been set in stone, unbreakable. It's like I've always dreamed, true harmony, unmistakable, unmistakable. Through each night we'll keep burning bright. I'm so lucky to be loved by you. And come the storms, whether short or long, well, I'll still be right where you are. I guess you could call it chance, but we know it's more than that. It's like we've always known, been set in stone, unbreakable.
If I told you how I feel, if I told you how I feel, would you be here still? Would you be here still? This February bit the dust, just like the one that gave you up. He stole the best you had to give and left you with a broken heart. Well, I guess that's what it's worth.
Could I believe in what my eyes cannot see? Or has the antidote to brokenness evaded me? Could I believe in what my ears have not heard? Or will the suffering that surrounds me have the final word? Even on the darkest nights, I know the sun will rise. I will trust the promise I cannot see with my eyes. Even when the clouds surround, I know the sun still shines. But when will it break through? Jesus, I need you. Touched? Or will the weight of disappointment apprehend my trust? Can I believe in what my mind cannot know? Or could the number of the stars contain my fragile hope?
Today's major home physical therapy is here. Please do this home physical therapy once or twice a day after getting up in the morning or before falling in the sleep from Monday to Saturday. Please put the alarm on your cell phone at the same time for regular home physical therapy. If your signs and symptoms are improved a week later, start the high level of home physical therapy. If not, keep it up the same or low level home physical therapy. Then, if signs and symptoms do not improve or pain worsen even after level 1 home physical therapy, please see a medical doctor as soon as possible and get an accurate diagnosis and test. Please watch the following video. Make sure you like the video. Thumbs up. Subscribe and turn on your ring notification. Have a beautiful day. See you again.